Hello, Somerville. My name is Ed Halloran, and welcome to the Somerville Labor Show. I want to welcome everybody watching on Somerville Media Center, also on YouTube. If you're not a subscriber, please take a look. We've got many shows up there right now. We've been doing these COVID-19 shows probably now since it began. Currently, we are approaching the third month of the stay-at-home order issued by Governor Baker. All of our shows that are on are focused on this pandemic as we continue to air shows regarding labor and the nursing exposure, lack of proper personal protective equipment, racial disparities, and its high rate of mortality. We've interviewed residents volunteering making masks, as well as our legislators working to get us through this crisis. My guest today is a social worker who is also the regional vice president of the DCF chapter of with 400, actually has 400 professionals in the SEIU Chapter 509. She also ran for mayor of the city of Somerville. Marianne Walles, thank you for coming on the show. I appreciate you being here.
Hi, Ed. I appreciate that you are spending a lot of time talking about labor and how it relates to COVID-19. I think it's really important because there are so many different challenges for everybody who's working or for every resident in our city and beyond that we're now facing and dealing with day to day, sometimes hour by hour, with changes and updates and how it affects people's lives.
Yeah, this virus is changing daily. It's really it's doing so many different things, not only to the economy, but whenever we think about our health, first thing I think about is physically, how am I? Am I sound? How am I feeling today? My aches, my pains, and going to the doctor. And the other side of it is that the mental health that's something that we really, I don't know. I mean, maybe many people just don't pay attention as much as they do. And what you do in your world deals with mental health, and a lot of people that are under a lot of stress, in particular during this period of time. Before we get into all of that, I just want to ask you a question just on a lighter side to start our conversation. Give me, what was it like to run for mayor? What was that like for you? What did it feel like?
I think the easiest part for me was meeting with people and talking to people. Being a social worker, that was the easiest part. I think that people sometimes struggle when they're knocking on doors or talking one-on-one with people. That had to be the easiest part. I think that was one of the biggest things I enjoyed about running, was actually meeting so many different residents in the city and just having conversations with them.
Well,
and then
on a positive spin, that is a plus for sure. What was the other thing? I apologize. I'm sorry.
and really listening to them. No, that's okay. And just really having the opportunity to listen to them and what was going on for them. I think that so many times we deal with issues as they come up, whatever in the media at one time, but people have so many different issues. Even when we're dealing with COVID-19, there are so many other issues that people have that have gotten lost in the crisis because people are focused on keeping people safe from the virus and how to deal with the virus. But things like mental health are going unaddressed because it's harder for people to access services. Substance abuse becomes harder for people because it's harder to access treatment and get support. We talk about mental health. People are feeling isolated who are in the best of mental health. So imagine if you already have some loneliness or depression and now you're really isolated, you're stuck in your house. You don't have that same access to people that you've relied on. Parents don't have that same break. Parenting is stressful any day of the week. Now you add in, okay, your kids are home 7 days a week. For those who are working at home, you're also then trying to teach your children, and those sometimes making really hard choices that you have to work because there are a lot of people working. And I think that over the last month, I think we've really taken a new look at who our frontline workers are. It's not just doctors, police, nurses, fire departments, ambulance. It's also like we've seen the grocery stores, the bus drivers, the train operators. There are emergency child care centers that are open to help support them. But there are a lot of people in custodians that have to still clean. There are direct care staff that still have to work. There's just so many people that still have to work. And these issues are affecting them.
Yeah,
And there are people.
right. I don't think anybody realized how essential they were until this pandemic hit. And now you're really feeling it. Now you're really feeling that you are, Department of Public Works, and all the things that we take for granted on the everyday things that we normally do. It's really taken on a life of its own. And the frontline workers have been really wonderful. But you know what? I agree with you. I think of people who are under a lot of stress, and we're going to get into that right now. Tell me what it is with Health and Human Services during this time. It's going to be really super emotional for people right now, the people that you represent. And can you just give me a flavor of what it is that your members and provide as social workers to the public? What you were doing has evolved into something else now, I'm sure.
So as social workers, and you rely on that one-on-one contact, going into people's houses, having those conversations, and now that's all been taken away. And you're relying on videos or phone calls, which makes it hard because for someone that relies on interpersonal skills, now we're on a whole different road of trying to have conversations with people, trying to assess people's needs by video. They're still going out and people are still going out in emergency cases, but it's a very different way of working with people. And again, it's all about that one-on-one connection that you can make in person with people that you can't necessarily make over a video or a phone call. The same when it comes to substance abuse, the same when it comes to mental health services. For some people who are isolated, those contacts mean the world to them on any given day. When you talk about our seniors rely on a lot of in-home services that have been cut from them because people can't get are told to stay at home. Seniors not likely to do video chats. They're left alone. It's very hard. And being a social worker, I find that's one of the hardest challenges, is to not be having that face-to-face interactions. And also not having that community support. We rely a lot on our communities to help us, teachers, doctors, nurses, counselors. We rely on them to help keep people safe. And now that's all taken away. Even domestic violence.
Let me ask a question about this, though. How has this affected, you were talking about the elderly, and I know it's difficult for them because, they can't, this is really, it seems to me that this virus is really, it is the older people, Black, brown people, it's really affected them, but it's really got different strains to it. But how's it affecting the clients? You can't go to the door. How are you contacting them? You guys having conversations? Are you able to speak to the elderly on the phone and people in need?
They're able to do that, but I think again, I think it's very different. It's a very different experience, especially when you're a senior and you're living alone and you so much enjoy that company. Even personally, seniors in my life that I enjoyed going over, whether it was for a cup of coffee or just that to have that contact with someone coming to visit, is all gone. It's not the same kind of contact. It just makes it a lot harder. I often wonder, for some of our seniors, what if they were to fall? How are they, is there anybody checking on them? The phone isn't always a way that you can tell that. or they're not feeling well. Sometimes, I think some seniors will say that they're feeling fine, but maybe they're not, and you can only tell by looking at them that
Right.
they're not feeling well. For those who can have memory issues, there's nobody there checking to make sure that they're taking their medication or making sure that they're eating. There's just so many different challenges that you can't do by phone.
Marion, I have to believe that people are frightened to go to the hospital at this particular point in time. I mean, they probably just don't want to go, and that's really what's happening right now. Do you have any recommendations for the elderly right now that are, that are concerned about that, and maybe something that they could do? I mean, I'm sure they're not all your clients, but people who are watching right now, they are needy. They do need help. You know.
They do. And I think all ages are afraid to go to the hospital. I think even when you're talking about mental health or substance abuse services,
Mhm.
people are afraid to go to the hospital. All they keep saying is, I'm afraid. I don't want to go to the hospital and get sick.
Mhm.
Because right now, that's what their bigger understanding. And I know more recently, there's been a lot of focus on, if you're sick, go to the emergency room. But it's very hard to explain to people who have fears that it's okay to go to the emergency room. You still should go there if you're sick or you need help, because they're so afraid of getting COVID-19.
Mhm.
And I think that sometimes we need to remember that. I think sometimes we forget that that's how fearful people are, and that it's a bigger conversation. It's a longer conversation
Right.
with people and trying to understand their fears.
Well, you're a part of a conversation that it's a series of shows that we're having. And, we've started with volunteers and some will making masks. We talked about that. There's also these little pods that they set up around the city where people can get help to help people who are elderly and people who are lonely and in need and sick. And I think it's wonderful. I think Summerville really has risen up to the challenge it usually always does that. And I know that's probably why you ran for mayor, and that's probably why you live in the city and you love it there. I work there. I love it myself. Let me ask you this question. This is really added. How are you and your colleagues able to keep up with this? I mean, it's got to be really difficult. I mean, is more do you find more and more cases coming in? Is it elevated now?
So I think that overall our cases, not so much, because that's when we talk about relying on the community to see things. And when the community is all isolated, it's very hard to see things. I think what we see now are more cases that draw attention from either the police or from the fire departments or medical personnel. So you tend to see that more. Where before we would, although we saw it from them, we relied heavily on a lot of teachers and counselors. So I think that has made it more worrisome that what's going on, because is there someone that can protect anybody? So when we talk about children, who do they turn to? They're stuck in the house all day.
Mhm.
There's not many different people they're coming in contact with anymore. When we talk about victims of domestic violence, they're really secluded in a house.
Mhm.
Um, there's not any place. Where are they going to go? Like, at least before, they had an opportunity to take their child to school and maybe access some help or tell someone what's going on. But people are really isolated from any ways that they used to use to let people know what's going on. And that is really concerning, not only for myself, colleagues. I think people are very concerned about what's going on and what are going to be the long-term effects of all of this when things start to open up. And when you talk 5 or 10 years down the road, for what they experience now and how it will affect their growth and development.
This is a huge challenge for everybody to take on, and we unfortunately, we have to rise to the occasion, rise to the moment. I think many of us, many people have been doing this, and it's really difficult the governor and the mayors and so many other things that have been going on right now. I'm, I think we all want to help in any way we can, and I'm so happy that we've had the people who've had this show. I had Donna Kelly Williams on. She's the president of the Nurses MNA Nurse Association. Really, caring people, and that's really what we're trying to do, to reach out to the people and let them know that they are not alone. Let's talk a little bit about that, about domestic abuse. It's really something that's increased significantly, from what I understand, and the crisis that it's emerged out of the impact of COVID-19. What is it that typical cases that you've had? I know you can't talk about explicitly certain things, but what is in domestic abuse? What is exactly that we're looking at with people when they report domestic abuse?
I think, well, it always starts off as being controlling, and usually people, when in relationships, if there's always an opportunity to reach out for someone, because we know that batterers tend to be controlling of people, control who they talk to, where they go. Most times when we talk about kids, they bring their kids to school, they have an opportunity maybe to reach out to a teacher because that's something that's planned, but that's removed now. And now you're talking even more stress. Unemployment is through the roof. Food is costing more and more. There's the pressures to pay rent, other bills that come across. Then you add into that, you have children home all day and the stress of trying to teach them and make sure that they get their schoolwork done. It's stressful on the best of relationships, never mind now on relationships that were already strained, where there already was some issues of control. Sometimes there's more drinking that's occurring now because people are home more. So it really has presented as a problem, because it's all that stress and people just let it out in ways that sometimes they would not normally have let it out, which means hurting other people. So domestic violence, because they're so isolated, there's been a few more deaths than there would normally have been recently. Shelters are strapped. It's hard because when you talk about accessing any services, whether it be because you're homeless or because of substance abuse or domestic violence, you're also talking about places that don't necessarily have the ability to quarantine people. And they're worried about, these are group living situations, so they're concerned about, if I can't just take that person off the street anymore like they used to be able to, because they have to worry about, are they positive? What's the chances that they could infect this whole residence? So without the ability to have a separate place to quarantine, a lot of people can't access those residential programs or those shelters, which again puts more stress on.
I do know they've set up shelters. I know the governor's done it. City of Somerville may have set some up as well. So people can go someplace to quarantine if they need. And it is difficult. I don't think, as much information as people get, and they probably not paying attention as much as they'd like to at times, because people want to forget about it. But on the mental health side, is there a number? Because I want to make sure we put that up that people can call, that they would be able to call. I think I might have.
For 211 is a state answer number. If you call there, they can direct your call to other services that are more local.
Okay, so I have a number. I have a number.
Person.
Victims can reach an advocate from 8:30 to 5 o'clock in the afternoon by texting. Now,
yes,
most people can text now. I think we're getting there on the texting, right? I've got a number of 781-281-4066. So that
yes, and that's through Middlesex DA's office.
Okay, and what can people do there?
They can reach out to an advocate for domestic violence if they need someone to talk to.
Great. What is SafeLink? That's a 24-hour hotline?
That's the 24-hour hotline for victims of domestic violence that they can reach out to. to safety plan, to see if there's any opportunity to leave the situation. They will help them. They offer counseling services. Um, they're a good resource for victims of domestic violence.
Okay. And that number is, I'll put that up as well, 877-785-2022. What is do you have another number here? It's a TYT?
It's the teletype for deaf and hard of hearing.
Okay, great. That's another one we will be putting up as well. That is an 877-521-2601. And we'll make sure we get those numbers up as well. So what are some of the other things that are going on currently with the social workers? You did mention something about drug and alcohol abuse. And you said that's increased. Is that increased dramatically now?
Well, we're still in the midst of an opiate crisis, but that seems to be on the back burner right now.
Yeah.
So there are still people overdosing, and that's what I mean. The social issues that were there long before COVID-19, they're still here.
Okay.
And they've kind of moved to the back burner in people's minds. So there are still overdoses occurring, which again, there's a multi-level issue with that, because the fear of going to hospitals, the inability to to get into treatment if they want, and then just the overriding, like people are so afraid of the virus that it just increases their risk of
Marianne,
that close contact.
Let me ask you this question. What advice are the social workers giving like the people, your clients, about the spread and how to prevent it? What is there anything particular that you've been able to give and pass along to your clients about that, who are very concerned?
I think clients are very concerned. I mean, they've been very clear, like we've explained, that we need to keep a safe distance, how, you try to explain about washing their hands. One of the hardest part is the whole PPE issue.
Yes.
It's been hard on a lot of workers. We're lucky. Initially, we had none, and then we were able to get some, but there's a lot of places that still don't have them, that do direct care. And then for clients too, it's that inability. Where do I go to get a mask? They can't afford the gloves. Like, I think that a lot of times we forget these little things that we all take for granted are even harder for some people.
Okay.
Masks are not easily accessible.
No,
we know that. There's a lot of homemade masks. We need to make sure that we're getting them out to everybody. I think that's a huge concern. Like I said, we've been lucky. We have gotten more to help protect us. They're not the same as what's in the hospital. I think there becomes that high level of concern around you're still exposing yourself.
Yeah. Well, what I have learned is that people are being very creative, and they're figuring it out, and they're at least a face covering for now. But what we have been learning is that the pellets, the droplets from someone can really, it's highly contagious. So everybody really has to be careful. We're running out of time because these shows are so fast. I have a question about nursing homes. Do you guys deal with nursing homes as well?
We don't really deal with nursing homes as much. I mean, I see there are workers in nursing homes. There's workers everywhere. Nursing homes, not so much. A lot of group homes that, again, it's all these co-living situations that I think were late in catching up. Like, I think that the illness got in there faster than anybody could keep up. And I know even in Somerville, they had a senior building that had to be quarantined. I think those places pose the highest risk for people. I worry about their ability of their staff to keep up, because people are clearly afraid, and I worry about the supplies that they may or may not be getting to make sure that everybody is safe.
Well, I think the problem here is that on the spread itself is the asymptomatic issue, because people have no signs, little signs if they're lucky,
Hmm.
and don't realize it. And that's how it began. That's just, we're learning more and more about this every day, and then it keeps throwing a curveball at us, and it keeps changing and constantly
Yep.
changing all the time. That's what's happening with this thing right now. So daycare for children. What are your thoughts on that? I mean, what's going on there, and how do you envision a new normal for them, for daycares and parents?
I think it's really, there'll be probably smaller amounts in a person's daycare, because they're going to have to try and keep kids as separate as possible. I worry about how expensive it's going to get for families,
Mhm.
because and if there's going to be a shortage of childcare, you can't, and nobody can go back to work until they figure out the childcare issue. I think that's the biggest thing you hear about. Well, how am I supposed to work if I have no childcare? I think that then there's that age group that is really too old for child daycare centers or childcare. The latency age kids who parents rely on summer camp for, or after school programs that are no longer there. They're not kids that you can leave at home either.
These are
There's a huge gap.
huge, very, very big challenges going forward. I don't, I mean, we're all going to have to get involved in this, but hopefully our political leaders will be able to do something with this and come up with something, because we need money. And I can tell you, there's another stimulus package that's up in Washington right now, and I hope it gets off the ground and moves quickly. And this political thing between Republican and Democrats, let's forget about that. Let's move on, and let's get money to the cities and towns where they really need it, and give them some infusion. I want to ask one more thing before we wrap this up, about people who are incarcerated right now. There are more of them being released from prisons due to the pandemic. Is there a place where they can go, so they don't risk infection to others? Is it like these homes you're talking about?
So I think that's another part of the problem. So you're releasing them so that, because jails, there's that confined living, but they're being released without a plan. Basically, I think that we're not putting enough thought into, they still need a place to live. Look in Boston they have a large homeless population.
Right.
Those people need a place to stay, and you're just adding to the problem.
So what you're telling me is that they're coming out, they don't really have a plan ready.
Right.
And they're sending them someplace, maybe, hopefully. I hope.
Or to the streets. For those that are lucky probably to have family, and then their families are worried, well, were they tested? Were they not? How much exposure did they have? Yeah, so you talk about all these spreads in communities, and you're not thinking about how, when you do that, you don't know, and then they go into a home that has more people in it, how fast it can spread.
Really, I got to tell you, we're running out of time. It's really difficult. It's happening so quickly, the spread. We hope that we can get a grasp on it. We talk about a lot of negative things right here. Give me about 30 seconds. Is there any positivity, anything positive that you can provide that's coming out of this right now in your world of what you're doing?
I think the positive thing is there are a lot of people that want to help in many different ways. And I think that's a great thing. I think in the time of crisis in Somerville and beyond, I think we see the better side of people being willing to help. And I worry about, it should be long-term, because it sounds like we're going to be dealing with this for a long time.
We'll find a way to adjust
I'm
to it,
hopeful.
for sure. We're definitely going to have to find a way to adjust to it. We're running out of time. I got about 30 seconds. I want to thank you very much for being on the show. And we haven't covered the social workers. I'm glad we have. I will have you back on, because I think it's going to evolve into something else. Behind me, there.
When we fight, we win.
Well, I stole that. Okay? And you needed a script, but I stole that. So I want to thank you so much for coming on the show. I appreciate everything you do. That's this t-shirt for you. And you know, when we
I
finally,
love the T-shirt. I loved your T-shirts, Ed. I still have my Only Insufferable T-shirt that I absolutely love.
that's my thing, over and out. Thank you so much for being on the show. Thank you, Marianne.
Bye.
Okay.